Hi everyone, I am Beatrice. In today's video, we'll be looking at ABG analysis. So that's arterial blood gases analysis. You will be able to analyze ABG after watching this video like a pro. And also we'll be looking at lots of practice questions. So the simplest method we'll be using so that when you see ABG questions, it will be very easy for you to analyze. If you are ready for today's lecture, let's begin. In analyzing arterial blood gases, there are several components, but we'll focus primarily on three, which will be the pH, the PaCO₂, and the HCO₃. First, the pH. So the pH refers to the degree of acidity or alkalinity of the blood. The usual pH range is 7.35 to 7.45. So that's the normal range. So that means the middle, which is 7.40, will be the ideal or the perfect pH. Anything shifting towards that 7.35 or even below 7.35 is showing a sign of acidity. That means the pH is dropping. And anything above that 7.40 or tending towards 7.45 or above, we are tending towards increased pH, which is alkalinity or base. Now, what can affect pH? The first one is too much acid, that's hydrogen ion. When it's too much, the pH drops. That leads to acidosis. The second one is too much base. That is either there's too much bicarbonate or there's loss of hydrogen ion, and that will lead to increased pH. The pH rises, causing what we call alkalosis. The next component we'll be analyzing will be PaCO₂. That's partial pressure of carbon dioxide. The usual range is 35 to 45 millimeter mercury. So what regulates PaCO₂ is respiratory lung control. So the lungs control this. And more CO2 means more acid, less CO2 means more base. That means if the normal range is 35 to 45, if it is less than 35, you are tending towards alkalosis. But if it is more than 45, you are tending towards acidosis, because more CO2, more acidosis. So that means when the PaCO₂ is less than 35, it means the patient is tending towards respiratory alkalosis. And that can be caused by when a patient hyperventilates. So the lung is trying to blow off too much CO2, and it can lead to respiratory alkalosis. And if the PaCO₂ is greater than 45, that's tending towards respiratory acidosis. Because more CO2, more acids, right? And this can be caused by when a patient hypoventilates. So when the lung try to retain CO2 in conditions like COPD, they are called CO2 retainers. So when they retain CO2, the lung is not blowing up the CO2. It can rise and get to more than 45. So we are looking at respiratory acidosis. The last or third component we'll be analyzing is the bicarbonate. So this bicarbonate, what regulates it is the kidney. So this is a metabolic control. The usual range is 22 to 26. And note that when you have more bicarbonate, that means you are having more base. You are tending towards metabolic alkalosis. And if you have less bicarbonate, you are tending towards metabolic acidosis. Now, how the kidney does this? When the blood is too acidic, the kidney try to reabsorb bicarbonate, because bicarbonate is a buffer and is a base. So when you reabsorb it back and excrete hydrogen ion, it buffers that acid and make it less acidic, because the body wants to balance itself, wants to be in a state of homeostasis. But when the blood, the pH is increasing and the blood is now tending towards the base side, what will happen is that the kidney will try to excrete that bicarbonate, because we know that more bicarbonate, more base. So it's going to excrete more bicarbonate and retain more hydrogen ion to increase the acidity of the blood and balance the system, so buffer it. Now let's look at the Rome method. So this Rome method means respiratory opposite, that's the RO, and ME means metabolic equal. I'll use this table to analyze it. So let's analyze it together. So the first disorder we could have is metabolic acidosis. So when there's metabolic acidosis, the pH, from that acidosis, it means the pH is going to be less than 7.35, or at least it's dropping below this normal range of 7.35. So the pH is going to be low. And then the primary component, because we are hearing metabolic acidosis, anything metabolic control, we are looking at bicarbonate. So the primary component will be HCO3 minus. Now we're saying metabolic acidosis. Remember, with the formula, the metabolic component is equal. So if the pH is down, the metabolic component too will be what? The bicarbonate will be down to make it equal in arrow. And if it's a metabolic issue, it means the lung is supposed to compensate. And the lung part that will be compensating will be PaCO₂. So the compensatory part will be PaCO₂. But how do we know what the lungs is going to do? So if you look at it here, the patient is in a state of metabolic acidosis, meaning there's too much acid. The lung is going to compensate by blowing off carbon dioxide. Remember that more carbon dioxide, more acid. So it's going to blow off more to reduce that acidosis. So when it blow off more CO2, what will happen is that there will be less CO2. So the PaCO₂ will drop. The next one will be metabolic alkalosis. So the first thing is we're talking of alkalosis. That means there is an increase in pH. So it's greater than 7.45. We say pH is going up. And then because it's also a metabolic issue, so we're looking at HCO3. And remember, metabolic says equal. So if the pH is going up, it must be equal in direction. So it means the bicarbonate is going to go up. Now let's see how the lung is going to compensate. Of course, we have established that PaCO₂ has to do with the lungs. But how do we know what the lung is going to do? Now, metabolic alkalosis will mean the pH is going up, right? And if the pH is going up, it means there is too much base. And remember that bicarbonate has to do with base. So there's going to be a retention. So what will happen is that the lung is going to compensate by retaining carbon dioxide. It's going to retain carbon dioxide, and that will lead to increase in carbon dioxide so that it can buffer that alkalosis. So the arrow here will go up, meaning showing that what? The lung is compensating by retaining carbon dioxide to increase the pH. Then we look at now the last two. The first one is respiratory acidosis. So first we know that acidosis has to do with decrease in pH. So we know pH component is decreased. Now, the formula says Rome. So this Rome or Roman method, respiratory says opposite. So if it's opposite, so if acidosis is going down, first we want to know the primary component. This is a respiratory issue. So we know that it's PaCO₂. And respiratory says opposite. So if pH is going down in acidosis, the PaCO₂ should go up so that it will be opposite in direction. Of course, what will compensate? It will be the kidney that will be compensating. So with the bicarbonate component. But let's see what is going to happen. What will the kidney be doing in this situation? So if it is acidosis, meaning there's too much acid. And remember, this is more of base. So the kidney is going to compensate by retaining or reabsorbing bicarbonate and excreting hydrogen ion, because more bicarbonate, more base, so that it can buffer this acidosis. So that means there will be increase in bicarbonates. And finally, the last one is respiratory alkalosis. So in respiratory alkalosis, first of all, alkalosis means the pH is what? High. It's greater than 7.45. And we know that is also a respiratory issue. So we're looking at respiratory is PaCO₂. And we say respiratory opposite. So if this is going up, so the PaCO₂ is going down to show that opposite, respiratory opposite. Now, of course, we know that if it is a lung issue, bicarbonate is also compensating. In this case, because there's alkalosis, meaning there's too much base, and remember bicarbonate is also too much base. So the kidney is going to compensate by excreting more HCO₃ and retaining more hydrogen ion. So if it excretes more, so this will go down. So it means there's going to be a decrease in bicarbonate, because we know that the situation is already more of base. So the kidney is going to excrete more bicarbonate so that and retain more hydrogen ion so that the system can balance up, the pH can come up. Now let's look at some practice questions with the knowledge you've gathered. You don't need to cram anything. And this Rome method, the easiest way you will remember that will not confuse you is just analyzing the pH first with the bicarbonate for any of the situation. and then you decide which one is compensating or which is not compensating. So the first one says pH is 7.29. 7.29. If we know that the range is 7.35 to 7.45, so 7.29 is showing that the pH is low. So pH direction is what? Low. This is tending towards what we call acidosis. And then the next one, remember I said we just analyze pH first and the HCO₃. Now for the bicarbonate, the usual range is 22 to 26. And we know that bicarbonate is a metabolic issue. So let's analyze these two first. So with this direction going the same way, using the room method, metabolic says equal. So you can see these two directions are going the same direction. So we can predict that this is a metabolic issue, so metabolic acidosis. But we are not done yet, because if it is metabolic acidosis, then we want to know what the lung is doing. So look at the lung. So PaCO₂, from what we see, is 36. The normal range is 35 to 45. So it's within normal. So we're saying normal. It's normal. And that's showing us that this is not even a respiratory issue. Now, because the PaCO₂ is normal, it means the lung is not compensating. It's not helping to blow up the carbon dioxide. So the final answer for this analysis will be metabolic acidosis, uncompensated. So that will be the final answer. Metabolic acidosis, uncompensated. Metabolic acidosis, because the arrow is showing that what is going on the same direction, which is metabolic equal, and it's a metabolic issue. We've established that, and then we know that the lung is not doing anything. The lung is just normal in range, so it's not doing anything in compensating. So we say it's uncompensated. Now let's look at this other practice question. The first thing, we analyze the pH. From what we see here, the pH is 7.51, so it's above the range of 7.35 to 7.45. So it's going towards alkalosis. The arrow, we are going to put it up, and that's alkalosis. When we're analyzing, so you never get it wrong with this room method, let's focus on basically the pH and bicarb first before we determine which organ is compensating. So for the bicarb here is showing 30. The usual range is 22 to 26, so the bicarb is also high, right? So its arrow goes high too, the same arrow. And this bicarb says metabolic, right? So anything bicarb here is metabolic. And because we know that from room method, let's see the room again, let me leave it here. From room method, metabolic says equal. So if you look at this arrow, this is going up, this is going up. So we know that this is a metabolic issue. And this is alkalosis, so we say metabolic alkalosis. So if we know that it's a metabolic alkalosis, a metabolic issue, the lung is what we want to know whether it's compensating or not. Now the PaCO₂, what we see here is 48. The usual range is 35 to 45. So it's going up. And we know that more PaCO₂ or more CO2, more acid. So the PaCO₂ is going up. That means the lung is compensating, is doing something. Because the patient is in a state of metabolic alkalosis, they're too much base. So what happens is that the lung is trying to retain more CO2. It's retaining more CO2 to kind of reduce that effect of alkalosis, because we know that more CO2, more acid is able to compensate. So we are saying that the lung is compensating. And because the pH is not normal, we will not say fully compensated, we will say the lung is partially compensating. So there is a partial compensation by the lungs. So the overall answer for this question will be metabolic alkalosis, partially compensated or partial compensation. That will be the final answer. The lung is compensating by retaining more CO2 so that it can increase the acid to counteract the effect of alkalosis. Let's look at the third practice question. So first we start with pH. Remember, we always analyze pH and bicarbonate component first. So pH, the pH from here is saying 7.35, that's normal. So what we can say in the arrow, we can say this is the arrow. And then the bicarbonate, from what we see, the usual range is 22 to 26. So the bicarbonate is going up. So the arrow is up. Bicarbonate is metabolic, right? So with this arrow here is saying normal, and this arrow is going up. So normal and up is still opposite in direction because it's not equal. So we know that the problem is going to be a respiratory issue. So, but what do we call this now? The pH is 7.35. The usual range is 7.35 to 7.45. Even if the pH is normal, it's at the extreme of normal, we are still going to say it's respiratory acidosis because it's still below 7.40, which is the perfect pH. So we're still going to call it, even if it's normal, we're still going to call it respiratory acidosis. And the organ that will be compensating should be the kidney. So let's see if it's compensating or not. Now, from what we see from this bicarbonate, the bicarbonate, the arrow says up because we are seeing 29. So because the bicarbonate is up 29, it shows that the kidney is trying to retain or reabsorb bicarbonate and excrete hydrogen ion. So definitely there's a compensation. So do we know if it's fully compensated or partially compensated? From the pH is normal, and whenever the pH is normal, we'll say, and we could see that the kidney is compensating. So it's going to be a full compensation because the pH is normal. So the final answer will be respiratory acidosis fully compensated. So that would be the final answer. Respiratory acidosis fully compensated. Let's look at the fourth practice question. So from this, with our own analysis, we're analyzing pH and bicarbonate for. So for pH, 7.46, so it's above the normal range. It's tending towards base, so we say the arrow is going up. That's alkalosis. And then the bicarbonate, now what we see is 21. The normal range is 22 to 26, so it's low. The arrow is going down, right? And we know that bicarbonate says metabolic. However, now the arrow is what we're looking at. This arrow is going up, this arrow is going down. That's a respiratory issue, respiratory opposite. So we know that this is already respiratory. And because there's alkalosis here, we say respiratory alkalosis. And that also means we want to find out if the kidney is compensating or not. Now let's see. The bicarbonate is low. Remember, this is alkalosis. So let's see, is it compensating or not? When the situation is alkalosis, where there's more base, the kidney is trying to compensate because it knows that the bicarbonate itself is base. So the kidney tries to excrete bicarbonate and retain hydrogen ion. That's why the bicarbonate value is getting low. It's excreting bicarbonate. And because of that, we say there's what? A compensation. Kidney is compensating by excreting bicarbonate and is retaining hydrogen ion. But is it fully compensated or partially? We will consider that with the pH. The pH is high, so the pH is not normal. We will not say fully. So we'll say it's partially compensated again. So the final answer will be respiratory alkalosis partially compensated. So that will be the final answer. Let's look at this last analysis. The first one is the pH as usual. With the pH, what we see here, 7.31. Usually it's 7.35 to 7.45. So this is low. The pH is low. That's acidosis. And then bicarbonate again. The normal range is 22 to 26. So 26 is normal. Normal means the arrow is just like this. So down and normal is opposite. So it's not the same direction. That's still respiratory. So we know it's respiratory again. Because respiratory is opposite. So down arrow and normal arrow is not the same direction. So respiratory, because it's acidosis, we say acidosis. Now let's see, is there compensation? If it's a respiratory problem, then it means the kidney, which is the metabolic component, is going to do something or not. But let's see, is the kidney doing something? It says normal. So the kidney is not doing anything. The kidney, the bicarbonate component is just there. It's 26, it's normal range. So we'll say this is respiratory acidosis uncompensated. So the final answer is respiratory acidosis uncompensated. So that wraps us today's topic on analyzing arterial blood gases. If you find this video helpful, please like, share, subscribe and leave your comments. Thanks for watching.